Welcome, dear listeners, to a moment of quiet reflection and gentle insight. Tonight, we immerse ourselves in the intricate dance of the medical world, a world of precision, care, and unwavering dedication. My name is Awade, and I'm delighted to share this tranquil space with you. Takes a delicate breath.
And I am Sharon, ready to guide us through the fascinating landscape of acronyms, pioneers, and the silent language of the surgical team. We invite you to settle in, breathe softly, and let these gentle words wash over you, bringing clarity and calm.
Sharon, it's such a comforting thought, isn't it, to consider all the organizations working quietly behind the scenes to ensure our well-being. Let's begin with a glance at some of these important acronyms that truly underpin the profession. Whispers with a slight smile.
Indeed, Awade. Take, for instance, AAMI. This nonprofit organization is deeply involved in the development, management, and astute use of safe and effective medical technology and devices. Their work is a quiet assurance in every piece of equipment.
And then there's the American College of Surgeons, the ACS, such a vital professional body for surgeons committed to improving the quality of care and setting those meticulous standards for surgical education and practice. Imagine the dedication involved.
Absolutely. And ANSI, the American National Standards Institute, a national guardian, if you will, overseeing the development and use of standards that touch all businesses, including the intricate web of healthcare. Their reach is vast, yet precise.
Such a thoughtful description, Sharon. Next, we turn to AORN, the Association for Perioperative Registered Nurses. They establish the very benchmarks in perioperative nursing education and practice standards, a true beacon for those caring for us around surgery.
And the international embrace of APIC, the Association for Professionals in Infection Control. Their mission is truly global, promoting worldwide wellness and, of course, the pivotal prevention of infection, a silent army against unseen threats.
So encompassing. And for the educational pathway, we have RAC/STSA, the Accreditation Review Council on Education in Surgical Technology and Surgical Assisting. They ensure that educational programs meet or exceed the established CAHEP accreditation standards, laying the foundation for excellence.
Yes, ensuring those entering the field are truly prepared. And the ASA, the American Society of Anesthesiologists, a national organization devoted to patient-centered care, ensuring the best possible outcome during those vulnerable moments of surgery, a commitment to comfort and safety.
A truly comforting thought. And then, for those working directly in the operating room, the AST, the Association of Surgical Technologists, a national organization representing their interests through education and a robust certification process. They are the unsung heroes of the sterile field.
Indeed. And in the broader public health arena, we have the CDC, the Centers for Disease Control and Prevention, a governmental organization providing crucial health surveillance and preventative measures against potential disease outbreaks. Their vigilance is our shield.
Such a vital watch. And then there's the CSPS, the Council on Surgical and Perioperative Safety, a council comprised of 7 health organizations, all united in promoting safe surgical patient care, a collective dedication to our well-being.
A powerful collaboration. And the FDA, the U.S. Food and Drug Administration. This agency promotes public health through its strict regulation of food safety, medications, medical devices, cosmetics, and even blood transfusions. Their oversight is truly comprehensive.
Their reach touches every aspect of our daily lives, doesn't it? And for those critical examinations, the NBSTSA, the National Board of Certification of Surgical Technology and Surgical Assisting, they develop and deliver the rigorous National Surgical Technologist and Surgical Assistant examinations, ensuring competence.
ensuring only the most capable are certified. And another governmental force for good, OSHA, the Occupational Safety and Health Administration. This agency enforces workplace safety and health standards, protecting those who protect us.
A crucial safeguard for all. And the Joint Commission, an independent organization developing standards and accrediting healthcare organizations. Their seal of approval speaks volumes about quality and patient safety.
A benchmark of excellence. And finally, on a truly global scale, the WHO, the World Health Organization, an integral organization within the United Nations addressing global health issues that impact us all. Their vision is truly universal.
What an incredible tapestry of organizations. Now, Sharon, let us shift our focus to the remarkable individuals, the pioneers in medicine whose brilliance illuminated the path for us all.
A beautiful transition, Oade. We begin with Dr. Denton Cooley, who perfected the heart-lung machine and performed the first U.S. heart transplant, as well as the first total artificial heart implant, a true titan in cardiac surgery.
Imagine the courage and innovation required for such feats. And Dr. Harvey Cushing, often revered as the father of neurosurgery, his dedication fundamentally reshaped an entire specialty.
His contributions were monumental. And Dr. Michael DeBakey, who developed the very first ventricular assist pump, a device that has provided invaluable support to countless failing hearts, a true lifesaver.
Such ingenious minds. And then we reach back in time to Galen, the first great anatomist whose biological insights profoundly influenced theological thought for centuries. His observations, though ancient, laid foundations.
From ancient wisdom to modern precision, Dr. William Halsted, who developed meticulous methods of surgical wound closure, a foundational technique that reduced infection and greatly improved patient outcomes.
The art of surgical closure, truly a craft. And Dr. Edward Jenner, who gave humanity the ultimate gift, the vaccination for smallpox, a breakthrough that eradicated one of history's most devastating diseases.
A monumental victory for mankind. And Dr. Joseph Lister, a pioneer who developed the groundbreaking techniques of modern antiseptic surgery, transforming the operating room from a place of peril to one of healing.
His impact cannot be overstated. And Ambrose Paré, a surgeon who revolutionized amputations by using ligatures to tie off arteries, a humane and effective improvement over cautery, a compassionate innovator.
A true leap forward in patient care. And Louis Pasteur, the indolable father of microbiology and immunology, whose brilliant work proved the germ theory of disease, completely reshaping our understanding of illness.
His findings echo through every hospital corridor today. And finally, Andreas Vesalius, often called the father of modern anatomy, who boldly performed dissections on human cadavers and created those vital, lasting records, a true visionary.
What an extraordinary lineage of brilliant minds. Now, let's explore the roles within the surgical team, understanding who does what and how their actions flow together.
We can categorize them as sterile, S, or non-sterile, N, team members.
A perfect way to illuminate their precise contributions. So, who conducts the preoperative patient interview, Sharon?
That would be a non-sterile team member, Aode. They are the initial point of contact, gathering vital information before the procedure.
Informative, quiet voice.
And who provides those additional items to the sterile field during a case? Gentle curiosity.
Again, a non-sterile team member.
They maintain the integrity of the sterile zone by carefully passing items from the periphery.
Ah, that makes sense. And then the ritual of the operating room. Who performs the surgical hand scrub and dons the gown and gloves?
That AOD is unequivocally a sterile team member preparing to enter that sacred space of direct patient contact.
And maintaining the patient's operative record, ensuring every detail is documented?
A non-sterile team member's responsibility, diligently charting the journey of the procedure.
Then, the meticulous preparation of the instruments. Who organizes the Mayo stand and the back table?
That is most certainly a sterile team member, arranging the essential tools for seamless surgical flow.
And after the delicate work is complete, who carefully applies the sterile dressings to the wound?
Another task for the sterile team member, sealing the healing process with care and precision.
And the crucial role of administering anesthesia and intubating the patient.
That, of course, falls to a non-sterile team member, typically an anesthesiologist or nurse anesthetist, ensuring the patient's comfort and safety throughout.
Absolutely vital. And assisting with the positioning of the patient before the surgery begins?
That task is shared, but primarily falls to the non-sterile team members, ensuring the patient is correctly and safely placed.
And the heart of the surgical interaction? Who passes instruments, equipment, and supplies directly to the surgeon?
That is the definitive role of the sterile team member, a ballet of anticipation and precise delivery.
And throughout it all, who quietly monitors the patient's vital signs during the entire procedure?
A non-sterile team member, ever vigilant, observing every beat and breath, ensuring stability and safety.
It truly is a remarkable orchestration of roles, each vital. Now let's move on to the clinical ladder and career development, understanding the different levels of expertise. We'll use EL for entry level, NA for novice, EP for expert, and PP for proficient.
An excellent framework for growth. So, communication skills that are effective enough to complete a case without emotional outbursts. Where would that fall, Aote?
Softly, with a hint of a smile. Ah, that foundational ability, that's definitely entry level, essential for any professional setting.
Indeed. And someone who quickly identifies assigned personnel while mopping the room and patiently waits when tasks overlap, what level of skill does that demonstrate?
That gentle awareness, that understanding of dynamics, feels like a novice stage, starting to see the bigger picture.
A good observation. And punctuality, being present for the scheduled case, demonstrating true dependability. Where would you place that?
Oh, punctuality and dependability are cornerstones, wouldn't you agree? Pure entry-level professionalism.
Absolutely. Now, consider someone who guides a student to pass items, preventing delays in the procedure. What does that signify?
Ah, that's moving beyond just doing to actively teaching and overseeing. That sounds like an expert, leading and enabling others.
Whispers admiringly.
A fine distinction. And the fundamental understanding, monitoring, and maintaining of the sterility of the setup. Which level is paramount for this?
Maintaining sterility is non-negotiable, a bedrock skill. That's entry level, a foundational expectation.
Soft, definitive tone.
Indeed. Now, someone who adapts their knowledge to scrub effectively in emergencies, demonstrating flexibility and quick thinking.
That adaptability, that confident pivot under pressure, that speaks to proficient. They can handle the unexpected.
Precisely. And someone who acts as a team leader, ensuring specialty items are at appropriate levels for complex cases.
A soft, guiding question. Leading the charge, anticipating needs, taking that broader responsibility, that's truly expert level, wouldn't you say?
Undoubtedly, leading with foresight. and accepting all patients, maintaining their confidentiality, showing honesty and respect.
These are the ethical foundations, the core of patient care. Absolutely entry level, non negotiable.
Indeed, compassion is universal. And identifying anatomical locations of organs correctly, where does that foundational knowledge reside?
That's core knowledge, isn't it? Essential for every role in the OR. Entry level,
Yes, the anatomical map is crucial. And finally, someone who confidently collaborates with peers on patient care decisions.
collaboration, confidence, making decisions with others. That's beyond foundational. That's true proficient growth.
A wonderful way to chart the journey of a professional. Now, let's reflect on the vital dynamic of teamwork. Communication, OAID, must effectively facilitate teamwork and shorten the forming and storming phases.
Yes, those initial stages. Essential elements, I believe, include clarity in delivering the message, active listening, and providing clear, constructive feedback. It's truly a dance of understanding.
A beautiful analogy. During the group development stage of forming, members are typically avoiding conflict, gently getting to know each other, a delicate period of adjustment.
And then the performing stage. That's when team members truly function as a highly effective, synchronized unit. It's a joy to be part of such a team.
A truly beautiful state of synergy. But teams can, regrettably, recycle into or even fail to emerge from the storming stage when true conflict resolution fails. Members must recognize self-interest and cooperate to meet those shared team goals.
Such a crucial point. Overcoming personal biases for the greater good. And what's the ideal way to voice a concern non-threateningly in a team setting?
The most effective way, Awade, is often to simply ask an open-ended question. It invites dialogue rather than debate.
Ah, that's truly wise. Now, let's explore navigating the hospital environment. We need to know which department to contact for various needs.
Indeed. For patient X-rays to identify breaks, for example, that would be for direct patient care within the diagnostic imaging department.
Makes perfect sense. And for an equipment gas alarm indicating low flow, where would our attention turn?
That's an indirect patient care need, leading us straight to maintenance or biomed. They keep the silent machinery of the hospital running smoothly.
Crucial support. And for blood needed for transfusion?
Direct patient care, of course, requiring the expertise of the blood bank or medical laboratory.
Absolutely. And if we need a patient bed from an inpatient room for post-operative transportation,
That's direct patient care, and typically the patient care unit handles these logistics.
and for something as seemingly simple yet vital as additional blankets needed for patient warmth,
That's an indirect patient care need, and we'd reach out to environmental services and/or laundry. Keeping patients comfortable is part of holistic care.
every detail matters. Let's delve now into the specifics of surgical technology. What were the three primary barriers to the advancement of surgery throughout history?
Oh, those formidable foes were pain, hemorrhage, and infection. They stood as monumental obstacles for millennia.
Such potent adversaries. And how was pain eventually nullified, Sharon?
Through the transformative development of anesthesia and subsequent pain medications, offering patients true respite from suffering.
A profound release from agony. How was hemorrhage eventually brought under control?
Hemorrhage was masterfully managed by introducing hemostatic clamps, precise ligatures, and the innovation of electrosurgery, stemming the flow of life.
Such brilliant solutions. And finally, that invisible enemy, infection. How was that controlled?
Infection was heroically controlled by the groundbreaking use of antibiotics, safeguarding patients from unseen perils.
Truly a progression of light over darkness. Now, let's consider the traits of true professionalism in this specialized field. Whispers thoughtfully.
At the core, Aode, are competency and commitment. These are truly essential in the workplace.
Firm, yet soft conviction. Absolutely. And beyond those, what other important professional traits stand out?
Numerous, yet vital. Conscientiousness, unwavering honesty, consistent attendance, unquestionable punctuality, understanding employer policies, skills competency, strict adherence to rules, fostering cooperation and team spirit, a commitment to continuing education, strong problem-solving abilities, effective prioritization, a willingness to serve on committees, flexibility, effective communication, a non-judgmental attitude, and always respecting patient decisions.
What a comprehensive and inspiring list. It truly encapsulates the essence of service. Now, for the AST professional organization, what benefits does membership offer?
Membership in AST offers invaluable support and essential activities. Benefits include continuing education, which is crucial for personal development, and, critically, improved patient safety. It also assists in maintaining certification, which explicitly requires ongoing education.
Informative, quiet description. So it's about constant growth and unwavering standards. And what about surgical conscience? What principles is it rooted in?
Surgical conscience is deeply rooted, Aode, in fundamental principles, accepting responsibility for one's actions, upholding absolute confidentiality, ensuring non-discriminatory treatment, promoting cost control, and maintaining a strong, unwavering commitment to practicing sterile techniques. It is an inner compass.
An inner compass, indeed. A moral and ethical framework for every decision. Now, let's briefly touch upon nonverbal communication. What are some examples of positive nonverbal communication we might observe?
Certainly. Positive nonverbal cues include open body language, a gentle smile, appropriate eye contact, and head nods that convey agreement. These subtle signals build trust and rapport.
They truly speak volumes, don't they? And why is nonverbal communication so crucial, especially in the operating room and healthcare in general?
Nonverbal communication is absolutely crucial in the OR and healthcare AOD because it conveys powerful messages without words, ensuring deep understanding, fostering seamless cooperation, and often comforting unspoken fears. It's truly a universal language of care.
So true. Finally, let's practice directing inquiries to the right place. For HIPAA inquiries, who should we refer to?
For HIPAA inquiries, we would always refer them to public relations. They are the guardians of sensitive information.
And any lighting concerns in the parking lot? Safety is paramount, after all.
Lighting concerns in the parking lot necessitate contacting security. They ensure a safe environment for everyone.
Absolutely. And if we encounter equipment issues, particularly something like exposed wires,
Exposed wires or any equipment concerns require immediate notification to maintenance or biode. Safety first, always.
indeed. And for preparing specimens for studies, which department is our go-to?
Preparing specimens for studies means connecting directly with pathology. They are the experts in analysis.
And if we need to report spills in the hallway, ensuring a clean and safe environment for all?
Reporting spills in the hallway goes directly to environmental services, who swiftly address hazards and maintain impeccable cleanliness.
Sharon, this has been such a soothing and enlightening journey through the foundational aspects of the medical profession. Thank you for sharing your thoughtful insights.
And thank you, Aode, for inviting this gentle exploration. It is a privilege to contemplate the dedication and precision that underpins such vital work. May these reflections bring a sense of peace and appreciation to our listeners.
Absolutely. Until our next tranquil moment together, dear listeners, may you carry this sense of quiet understanding and appreciation for the intricate world of healthcare.